According to a report by Ontario nurses, 2,045 nursing positions have been cut across the province over the past year. Does the acting premier believe that Ontario can lose more than 2,000 nurses without a devastating impact on frontline healthcare in this province?
Premier, Minister of Health. Minister.
Well, thank you, Speaker, and let me begin by reiterating our commitment to nurses. We know that nurses are, in fact, the backbone of our healthcare system. That's why we have got almost 10,000 more nurses working today than when we took office in 2003.
Nurses from Peterborough are in the gallery today, Speaker. Last week, they were told that their community could get by with 121 fewer nurses. Those cuts mean 250,000 hours of lost support for Peterborough families. Is the minister saying that these nurses weren't providing frontline care? Or will she admit that the families in Peterborough are losing health services that they rely on?
Speaker, the situation in Peterborough is one that has been pretty serious. That's why a peer review team was sent there, led by Dan Carrier, the CEO of Southlake Regional Hospital. I'd like to take this opportunity to thank them for their work. They very clearly indicated through 60 recommendations this is not a revenue issue at the Peterborough Regional Hospital, Speaker. The issue is that there are some serious management and governance concerns. In the longer term, I actually think we've got some work to do internally. So the first thing we're doing, we're working.
We have 2,045 positions to date that we can tell you about. We have more that we have been notified of, but it isn't formalized yet. That is equating out to over 4 million hours of nursing care. The fact is it's across the province, it's a virus happening, and they're cutting the nurses to balance the budgets and impacting the care that we're able to provide.
And they're right across the board throughout the entire hospital.
These are the nurses that are in Peterborough that know the number of positions in each of the units that are proposed to be cut, and we didn't even include those numbers in our chart. Yeah. Nor have we included some of the other hospitals of representatives here that haven't formally been announced.
Yeah. But that's right.
It was very disappointing. I was especially disappointed in Deb Matthews' responses to Andrea Horvath. I thought she wasn't really getting the whole impact of all of these cuts. She was mainly concerned about what they have done with the nurse practitioners, which are great, but what about the rest of the bedside nurses looking after the patients day to day?
Like I graduated 2 years ago, and I still haven't had a chance to get a full-time position. I've been working part-time the whole time.
Well, we're replacing registered nurses with registered practical nurses and PSWs. The hospital's maintaining that you're getting more hands-on. We'd like to be concerned about whether the people that are going to be taking care of the patients are going to have the education and the skills to take care of these people that are in hospitals. We all know that hospital patients are now having higher acuities, and these are the patients that should be taken care of by registered nurses.
My numbers, I guess. I don't know why he didn't.